Good morning, everybody. Thanks for being patient. I am really excited to be here. I am a West Coaster and I also have 2 young children, so I appreciate your patience because that meant I had a kiddo crawl in my bed early this morning and then kick me in the back for a few hours. And it just takes me some time sometimes to get moving in the morning and to get my kids kind of riled up so that I can make a video uninterrupted. Thankfully, I have a great partner, my husband. So again, super excited to be here. I have tons of information to share with you. And I guess I just want to start with by giving you some more information on myself and what my career has been like. So I started my career actually when I first initially went into my undergraduate career. I went to the University of Washington, go Huskies. And, I wasn't really sure what I wanted to study, but I knew I was interested in the sciences. I know we all kind of say, well, we want to help people. And we think to ourselves, well, maybe that means medical something. And so I actually did start sort of in like a Okay, so I thought I did these videos ahead of time, which I did, but it's not working when I upload it. So I'm going to go ahead and pick up where I left off in the last story and hope that things make sense. So bear with me. So as I mentioned before, I knew I was interested in the sort of pre-sciences, and I actually really did enjoy my science classes. It was a little intimidating, but it was something that I actually really enjoyed doing. So I actually ended up changing my major completely. I majored in public health, took all the science courses, went and lived in Kenya for 3 months because mid-college life crisis. And I was going to get my master's in public health, but at the last minute, it just didn't work out. And I think it's worth noting that my volunteer time with the East African Center was amazing. It changed my whole life, my whole outlook. I now work with underserved patients most of the time because of this. I'm going to tag them here. They're wonderful. So I graduate from University of Washington. It's a tough time in the recession, and I sort of land into a role and job in clinical research. And it's something you may not know anything about until you start working. So I worked as a research assistant in phase 1 clinical research trials. I then worked in later phases with COPD patients, multiple sclerosis, and eventually was going to move on to cardiac valve trials. And this really afforded me some really good experience. So what I was able to do with this time was that I was able to really shadow all types of healthcare roles, physician, nurses, physician's assistants, nurse practitioners, and I found myself really drawn to NPs. And I thought to myself, you know what? That's my career. So then comes the hard part of how do I become a nurse? Because the blessing and curse of nursing is that there are a lot of different ways to the same goal, and it can come with controversies and who knows, but you've got to find what's best for you. So I had all this healthcare experience as a clinical research coordinator, a bachelor's degree, and so naturally I looked into a nursing immersion program, which can come with its controversies, ups or downs, but it worked really well for me. So I ended up going to Seattle University, which was a wonderful program. It was very rigorous. It's a nursing immersion program that actually is blended with other nurses who have been a nurse before. And it works really, really well because, for me, it was really important to be at a school where I actually went to class. That was important to me. I also wanted to make sure that I was with a school that was integrated well enough in the community where they could help me find my clinicals, because that can be a real challenge as a nurse practitioner. And so for me, this worked really well. And for some people, they'll say, well, you really need to be a nurse for X amount of years before you can be a good nurse practitioner. And then there are other people who say, well, it's a hard transition from RN to nurse practitioner. I think finding what works best for you with your comfort level, you're never going to know everything. And there are great people in every profession, and there's also some that struggle. So do what works best for you. So I go through my program, which was really great and very challenging. And I actually ended up taking my family nurse practitioner certification at 38 weeks pregnant. If I can do it, y'all can do anything. And I kind of had planned this in a way-ish. I knew that it would take some time in between finishing school and starting my first job. And that's something to really keep in mind. Licensing and credentialing can take a very long time, especially when you are a new nurse practitioner, no matter what your specialty. So making sure that you know there's going to be a gap of time in there. I chose to use that as a maternity leave. I will absolutely come back to this as to how this changed my whole life. And if you have children, you know that this is not a vacation. If you don't know what you're in for. But I was really excited to start my first job, and I eventually was able to after about 4.5, 5 months. So my first job as a family nurse practitioner, I actually worked at a low-income, underserved, underinsured population, and it's because I was a National Health Service Corps scholar, and this is a great way to get your schooling paid for and give back to the community and learn a ton. I have learned so much over the last 5 years working in underserved populations. I've worked in rural populations, and this can come with its pros and cons. You have to make sure you're in a space where you feel supported, and that can be difficult in these populations because they're typically looking for providers because there aren't a lot of providers who want to work in these populations because it's challenging, but it's really great and it has really provided me with a great foundation for the provider that I am today. And I have no more student loans. I've been working as a nurse practitioner, and remember how I mentioned I took my boards at 38 weeks pregnant? Well, if you go over to my page, which I'm going to tag here, you'll know that my personal story has absolutely shaped where I'm headed with my career. And this also is how nurse practitioners can find gaps in the healthcare system and fill them so well. We are so needed. So I had really awful postpartum depression after my first child was born. And I was able to seek care, and I actually saw a psychiatric nurse practitioner, and it was life-changing. And so when my husband and I decided to move to Northern Nevada, which is where we live now, I quickly noticed that we were severely lacking in resources that I myself had utilized as a patient. And I thought to myself, no, women and birthing people need this service. So in true Andrea fashion, I said, I'm going to do it myself. So I decided to go back to school again. My husband was thrilled, but I was really interested in getting my postmaster certification in psychiatric mental health. And really in a lot of areas, there are a lot of family nurse practitioners, family physicians who are doing a lot of mental health care because there is such a great need. And I can tell you in Northern Nevada, we have such a great need for mental health care that there are a lot of family nurse practitioners who are inadvertently just doing a lot of psychiatric care because there just isn't anyone else to see them. And I really felt like I needed more knowledge. And so I went back to school, and it has been so incredibly great. I love the program. It's much different than my first, which I think that's the great thing about nursing, right? Something that worked for me before probably isn't going to work for me now. And that's because I'm at a different point in my life. I now have 2 young boys who are the light of my life. I'm also working as a family nurse practitioner, but I also started the very first program in Northern Nevada to actually integrate mental health into a women's health obstetrics office. And it is so incredibly amazing the difference we can make in patients' lives. So obviously I have a lot going on. So going to class every day would be difficult. So thankfully I'm at a program with the University of Nevada, Reno, where I can do most everything online. They do arrange our clinicals for us, which is a huge thumbs up for me. Remember, that is something that I really need help with. And it's a really great hybrid. And so again, finding what works for you at the time that you are in your life is great because it's not going to be the same for everybody. And that's what makes nurses so darn awesome. So I have basically been cramming like 10 years into the Instagram stories here, which is awesome. And now I'm at a point in my life where I'm going to finish my schooling in May of 2020, which is so exciting. I am also working on a separate certification with a wonderful organization called Postpartum Support International. They are one of the leading organizations that helps to educate both patients and providers on perinatal mood and anxiety disorders, which most people refer to as postpartum depression. And that's what I'm going to be focusing on, working with pregnant and postpartum women and their mental health. And how great to have my family nurse practitioner background, because most birthing people and women don't have a primary care. So I end up filling both roles for a lot of these women, and it is such a great gap in healthcare that we are filling as a nurse practitioner. So what I'm going to do is I'm going to go ahead and post a question box. So please send your questions in. I know I have a lot of information to cover. I'll do my best to answer them throughout the day. And swipe forward to see if we can go ahead and check for a time maybe to do a live and see what would work best for you. I'm also going to be here tomorrow. So not only do you get me on Sunday, but happy Monday. I'll be the face you get to look at all day to ask your questions. So please ask me anything. Go over to my page and follow me so you can get all the information that you need to take care of women. And remember, this is for everybody. Whether you are a nurse, a friend, a partner, Everyone knows someone who is a woman or a birthing person, and we all need this information because it really matters. So head on over to my page, follow me. It's going to be great. Thanks so much, you guys. Good morning, everybody. Thanks for being patient. I am really excited to be here. I am a West Coaster and I also have two young children, so I appreciate your patience because that meant I had a kiddo crawl in my bed early this morning and then kick me in the back for a few hours. And it just takes me some time sometimes to get moving in the morning and to get my kids kind of riled up so that I can make a video uninterrupted. Thankfully, I have a great partner, my husband. So again, super excited to be here. I have tons of information to share with you. And I guess I just want to start with by giving you some more information on myself and what my career has been like. So I started my career actually when I first initially went into my undergraduate career. I went to the University of Washington, go Huskies. And, I wasn't really sure what I wanted to study, but I knew I was interested in the sciences. I know we all kind of say, well, we want to help people, and we think to ourselves, well, maybe that means medical something. And so I actually did start sort of in like a Okay, so I thought I did these videos ahead of time, which I did, but it's not working when I upload it. So I'm gonna go ahead and pick up where I left off in the last story and hope that things make sense. So bear with me. So as I mentioned before, I knew I was interested in the sort of pre-sciences, and I actually really did enjoy my science classes. It was a little intimidating, but it was something that I actually really enjoyed doing. So I actually ended up changing my major completely. I majored in public health, took all the science courses, went and lived in Kenya for 3 months because mid-college life crisis. And I was gonna get my master's in public health, but at the last minute, it just didn't work out. And I think it's worth noting that my volunteer time with the East African Center was amazing. It changed. Hey guys, Andrea Thompson here, nurse practitioner, signing off from Nurse.org. Thank you so much for having me for the Instagram takeover. If you have future questions, you can check out Nurse.org, the highlights on our page, or head to my page, andreathompson.np. Have a good one.